COVID-19 pandemic has forced a shift in the perception of the healthcare sector and also challenged the resilience of business operations. Private healthcare providers are therefore appealing to government to acquire enough vaccines and urgently roll out vaccination drives in order to avert the undesirable social and economic impacts of the lockdowns.
And so that's why vaccination must be the top priority for this country. It should be the top priority in budgeting, in expenditure. It should be the top priority in lobbying. It should be the top priority in implementation, so that when we get vaccines, we roll them out fast.
The Federation also recommends the introduction of a medical credit scheme, urge government to support the setting up of national health insurance schemes, evolve the supply of medicines, and embracing of public-private partnerships in dealing with epidemics.
Facilitate growth in health. Private health sector investors need affordable financing through a medical credit scheme. Health, like agriculture, has unique characteristics that should be considered differently. Thus, like the Agricultural Credit Fund, there is need for a low-interest finance mechanism tailored to the health sector.
Now, government is committed to setting up the National Health Insurance Scheme, and that's why you saw that Parliament was very keen on this. And we do understand as government that it is only through getting a prepayment scheme in place and getting a payer with enough market power to negotiate pricing that we shall be able to start reining in the issue of complaints around costs.
The Federation members, led by their president, Dr. Ian Clark, refutes allegations of the private healthcare providers profiteering from the pandemic through excessive charges in intensive care units.
But the implementation of very complex care, which requires a very highly trained intensivist, who's an anaesthetist who's got more training, in fact, or a physician, which requires very complex equipment that needs a lot of upkeep and monitoring and so on and so forth. And you have to put all those things together, plus very complex drugs, plus complex nursing care. You don't put that together in a day.
The public is shouting and saying, reduce the costs, control the costs. Yesterday we had a very good conversation that has shown that you cannot just control costs without regulating the entire spectrum of healthcare. Because you know that even people who have gone into hospitals and paid a lot of money, many have died.
Sigoa Dennis and Zahara Abigaba for UBC News.